episode 1.
Yay.
Finally. Man, this episode has been a long time coming.
It really has, but I'm really excited about today.
Me too. It finally, like I said, left the group chat, but in this case, our team's chat.
Yes, and we are here.
We're here.
We have our coffee.
We're going.
It once had ice.
My face has a little ice.
Oh, that's so nice. You can't hear a sound from me.
Fine. But we can see, our viewers can see. It's a long time coming.
The setup,
episode.
it looks great.
Yes, I'm really happy about all this. All right, first episode of Driscoll Decoded. I'm Angela. I'm going to be your host for this series.
And I'm Victoria, and I'll be your co-host.
I'm so excited that we're doing this podcast. There's so much information out there, and social media has offered so much just within that, and I think this is a brand new avenue that we can go down and expand so much more knowledge and decode a lot for our viewers.
Agree. It's going to be fun.
So Victoria, you are our first guest onto the pod. Tell me what your role is here at Driscoll Health Plan.
Yeah, so my full title is Director of Eligibility, Enrollment, Communications, Community Outreach. I know it does not fit very well on my business card or on an email signature or on my ID badge. It's actually cut off.
It didn't even finish?
No,
Not
they
like
just stopped typing.
Oh,
yeah, it just gave up.
Oh my gosh. That's funny.
It actually, I think it ends on com.
That's such a good title too for it just to stop.
Yeah, the text is super small too. It's not like anyone can even read it.
All right. Tell me a bit. Okay, that's a lot. Tell me just at a high level what your role is and who you manage.
Yeah, so at a high level, we are responsible for all member and provider communications, both regulatory, non-regulatory, health education, anything that's developed with the Driscoll Health Plan logo. That's what we're responsible for.
Nice. That's a lot.
Yes.
That is a lot. A lot of flyers, a lot of communication.
Yes.
So anything with the logo on it, your teams are in charge of it.
Absolutely.
Nice.
We've seen it. We've approved it. Mm-hmm. It's, we figured out how to put it out in the areas that's needed. We're also responsible for the data of our members. And so that comes over once they are eligible for Medicaid. Mm-hmm. And now we make sure that it's all correct in the systems.
Yeah.
We have mailroom operations that's responsible for producing all of our letters, postcards, flyers.
How many do you think they see?
Oh my goodness.
Within a week, if anything?
Oh, I would say probably around a 50,000 mark.
Oh my
yeah, it's a lot.
Move over USPS. No.
I know. We could do that and software.
Oh, man.
Yeah, they're super skilled in their area, and I'm always impressed of what they're able to get through every single day. Mm-hmm. We have our member advocates who are responsible for advocating for our families if they're going through, an appeal or something. They are there to make sure that they are walked through step by step on the process.
Nice.
We have our enrollment team. So as soon as you enter Driscoll Health Plan, you're going to receive a text saying welcome. That's our team also.
Nice.
We have our community outreach team that's out in the area, marketing. They are the face of the Driscoll Health Plan. If you see a table display, banners, anything out there, that's our community outreach ambassadors.
Yes.
And
they're so nice. I really encourage everyone who's listening to this, if you ever see a Driscoll Health Plan table out there, go up, say hi. Yes. They are so happy to see you, so happy to talk to you. So.
Absolutely. And they really take, pride in what they do every day. They love what they do. You can see it in them. Every time they speak to a family, they speak to a professional, you could just see the love that they have for Driscoll Health Plan. We also have our health educators who are out there educating on various health topics like hand washing, flu. They're in our schools, our Head Start. So if you see someone out there, also go and say hi because, they have to present to different audiences all the way from pre-K all the way up. So they adapt their presentations to that audience. It's really impressive.
Oh, how exciting.
Yeah.
I love learning whenever you speak about our team. I say our because I'm on your team.
Yes.
It's so fascinating how much work everyone puts into it and everyone's role in it, you know, from distribution to content creation to development, man, and then outreach as well. Like, I know outreach, they're hardly in the office.
Yes.
And they're out in the community traveling all the time. So there's a lot that you manage, and I give you so much props because you're always coming to office. I love hearing Victoria, hi, hello, and you're just so pleasant, and I feel like it makes everyone works so cohesively with each other. There's no, like how you say, like from Taylor Swift, but bad blood.
Love it.
In the department. Everyone just works so great together. There's so much trust and building of like getting your part done and having it completed and having it reviewed and everything like that. So I think you are a great leader. You lead with such poise and such excellence. I feel like you are truly a mentor that I would like to like follow under.
Thank you.
And just a great leader overall.
Well, I appreciate that.
Yes. So explain a bit like how you got to this director position.
Yeah, so I will go all the way back to right when I was about to select a college.
Okay.
I ended up applying to Texas A&M Kingsville, 45 minutes from here. I decided to pursue a degree in biomedical sciences with a minor in chemistry. I chose that because I love science, I love math, I love that whole, health aspect of literature, and just I was so interested in it. I didn't know what I wanted to do, but I was interested in that area.
She didn't know what to do, everyone, so she went with the hardest degree out there, and it's chemistry and biochemistry. And if everyone knows what kind of courses you had to take for that, you give this lady props.
I didn't realize, honestly, when it looked cool, and I was like, that sounds fun. And then I started taking classes. I'm like, what on earth did I sign up for?
Gotta finish it out.
I have to finish it. I mean, that's the thing. Once you start it, I really am. We're gonna get there.
Yeah.
We're gonna finish it, and regardless of how hard it is and
Nice.
how many different paths it's gonna take.
Yeah. Agreed.
So I did that. I actually had, I was so blessed in my undergrad degree. I was able to find this gentleman that was in one of my chemistry classes. He was from Nigeria, and I remember sitting next to him. He knew all the answers, and I was over here struggling, and I'm like, how is he so smart?
I need your brain.
Yes. And then I had him for another class, and then I had him for another
Nice.
class. And so eventually I just told him, like, hey, can I just study with you? And he was like, sure. And he was
Awesome.
actually, I think, 2 or 3 years younger than me, and he was in my classes.
Oh,
like,
wow.
I mean, just a genius.
Yeah.
He was pursuing a chemical engineering major.
Wow.
Yeah. So, I mean, my degree was hard, but that's a hard degree.
I wonder where he's at now.
Oh, he's big, Valero,
Ooh.
big top position.
Oh.
Pursued a doctorate in chemical engineering.
Oh, of course he is. Nice.
But this guy, a big follower of Christ. I mean, that's also another way we got close. I mean, he went
that's
to
amazing.
Baptist Student Ministries, the whole thing. And so we would work hard, study hard, and then rejoice.
Oh,
and it was
amen.
just a
That's
really good
awesome.
friendship.
Yeah.
And so that's how I got through my bachelor's degree, honestly.
By the grace of God.
Yes, absolutely.
Literally, and help. Yes,
absolutely.
that's amazing.
And so then after that, I actually was trying to figure out what's next. And I thought, let me try healthcare. Why not? It sounds fun. And so I applied to nursing school, and I actually got into the Texas A&M Corpus Christi nursing program here.
Nice.
It's really good for anybody who's interested. They have really good completion rates also. So I was in about my end of the first semester. I went into a surgery. It was an open knee replacement. It was the most traumatizing visual ever for me. I mean, everybody else was like really cool. The surgeon was so nice, showing us how the leg moved. And
oh my goodness.
I was like, I'm not feeling good.
feeling
Yeah, I'm really feeling
gonna
the
end well.
excitement in here. That was not the excitement. It was definitely my blood leaving me.
Oh,
and so, instead of like attending to the patient, they had to start attending to me.
Man.
That was my breaking point. I was like, I can't do this. And so I decided to go ahead and, no longer continue the program. That's a big decision.
I bet that was hard.
Yeah, it was. I really had to self-reflect, and I had to tell myself, you know what, be honest, you're not going to do this. And so there's no way. No one's going to want you in their patient room. So I had to reflect. I prayed a lot. God kept putting in my heart, you really do like business and you like to lead people. And so, I was okay. I was like, yeah, you're right. So I started calling around different institutions. I found an online program and spoke to the advisor. I decided to pursue a master's in health administration.
Nice.
And I completed that within 1 year, all while working. And it was very difficult. But sometimes, you have to, hone in and kind of understand what's your end goal. Where do you want to be? Can you sacrifice a year of extracurriculars, all of that other stuff that makes up life. Yes. Yeah. Can you do that? And, it's hard. It's hard to make that decision. I remember missing a lot of different family functions, or I would go, but I had a laptop. Yeah. And so I was halfway mentally there, right? But I knew it would be worth it. So I did that. I was working as a medical assistant. I was not touching people. And then I eventually got a position as a clinic regional coordinator. Cut. So
a regional. Scratch that.
Just JK. So I eventually received a position as a regional coordinator for DaVita. It's a nationwide dialysis company, and they had about 13 clinics in our service area. And so I helped support my executive director, and I learned a lot about operations there.
And as you're going for your master's as well. So real time, you're learning like textbook, and then you're learning real life situations. Yeah. Oh, that's amazing.
I asked a lot of questions too, which is really good. I advise anyone, just keep asking questions. People are willing to teach. They really are. They just don't know what you want to learn. So I then seeked out a clinic management position that opened up at Krista Spahn, received that position. I was 25 years old, and I had a big girl hat on. I had 12 physicians were there, 15 full-time employees. I was responsible for big girl things. And so
question, being 25 and having, that role, was that difficult to kind of maneuver sometimes with, people who are older or even other management that was older? How was that going through that?
Yeah, it was really hard. They saw me as a kid. I mean, I was young. I was a kid basically, but I went in every single day with just knowing what I had to do. And it's the way that you explain, okay, this is going to be our goal for the day. And as you provide their support too, if someone like a physician needed support for a document, or maybe they had a question about this, you made sure you got that completed. And as you continue forward and they see that they can trust you and that you're reliable, I slowly started getting that trust from them. Nice. But it took a lot of effort. Yeah. And sometimes I would suggest something and they would just kind of like, oh, well, I don't know about that. But and on top of that, I had a really strong executive director who said, you know what, I'm going to take you under my wing and kind of help and mold you. She saw potential in me. And
that's awesome.
I still remember her. I mean, her name's Anna. I think about her often because she was the first person who ever took a chance in this type of role for me.
Yeah.
And so with that support, I mean, honestly, you could do everything possible, but you really need that strong support above you too. And it makes a world of difference if you do have that. And if you don't have that at work, you have a strong support elsewhere too. Maybe it's your family, maybe it's a friend.
Yeah.
Of course, you have God there all the time. You have to have that support system somewhere. And I did. I was very blessed that I had support in all aspects of my life through this journey. And so after that, my husband called me one day and said, hey, what do you think about moving to Temple? I was like, Temple? That's north of Austin, right? That little area between Waco and Austin. And he was like, yeah. I was like, wow, okay, that was a big decision. He had just received a residency there, and I started doing some research. I learned that there was a big system, Baylor Scott and White. I mean, it's huge.
Yeah.
And so I said, you know what? That's going to be a really good health system to enter.
Mm-hmm.
I started looking at opportunities, applied for a position as a project manager, entered a very interesting type of interview process. At a high level, there was about 25 people, 10 to 12 different rooms. They put you in a room with everyone to solve puzzles or scenarios, and they just sit in the back as a panel and watch you stumble and work your way through the solution.
Interesting.
Yes.
Yeah.
And at the end of it, they give you a paper where you had to work through a scenario, but they wanted to see how your thought process was. So everything you were thinking, you had to draft up.
Okay.
And then they took all the papers, came back and said, okay, everyone can leave but Victoria Morales. I was like, what? Like,
oh my
I felt like I just
gosh.
I was like on a reality game
Yeah.
show.
Me?
It was
That's
the
awesome.
most craziest thing ever.
Yeah. And after a long day too, right?
Yes, it was about 8 hours of that,
Yeah.
and you're mentally exhausted. But they wanted to see you honestly in the trenches. They wanted to see how you perform under stress and adrenaline.
Yeah.
And so that position at Baylor Scott and White, my goodness, it opened my eyes to so much potential, so many opportunities. I learned from administrators there. They were just so willing to teach me what operations entailed in health administration.
Oh, wow.
And honestly, I learned a majority of my skills there.
Okay.
So then after that opportunity,
How long were you there?
I was there for a year and a half.
Okay.
Yeah. So then another call, right? Here it goes. It's on my husband. We need to talk.
I don't know about these calls anymore.
So he received a really good position to come home, and this is our home. This is our family, and you know it was tough, but at the same time it was easy because I knew I wanted to come back some way. And so we got very blessed. I received a position here at Driscoll as community outreach manager.
Here we go.
So everything you see out in the community, I was a manager for that.
Yeah.
And it looked very different at that point in time. You know, we were still developing what community outreach was. So it was the perfect time to come in. And my director, she was honestly, I think out of everyone, the most open and willing to mentor me through a very tough process. She was very straightforward, but at the same time, very loving. And so I was able to make mistakes. I was able to redirect my mistakes several times. I remember the first thing I turned into her, she redlined it all over the place. And I was like, I'm going to do horrible. I'm going to fail. And she just said, try again. And I was like, okay. So I just had to keep doing that. And that was our approach. I would do something. She didn't like it. It was like, try again, try again, try again. And so I think that helped like kind of make me work harder. I researched a lot on how I can be successful in my role, what was needed, what did I need to take extra, trainings. And I did. I actually would practice in front of a mirror, just how to talk in a meeting. If I needed to present, I would present to myself in a mirror. I would film myself. And so through all of that, I started developing that skill set. I still have a lot of work to do, but it helped me quite a bit.
I noticed you have, from what you told me, you have this characteristic that other leaders see from you. Because every story, there's someone that wants to take you under their wing, that sees so much in you. I can only imagine where you're going to go from this director's position, and also like who you're molding behind. And it's just going to be like a streamline effect. Yeah. And I can already see that in place.
Thank you.
Now. Sorry, continue.
Well, thank you so much. And honestly, I've just been so blessed. That's the moral of my whole journey is it goes back to God.
Yeah.
Yes. I could not have ever envisioned that this is where I would be. And so, with that community outreach manager position, I then was promoted under her as a member services and outreach manager. That just entailed a lot more responsibility to help with the department. Our department's big, as you've learned. And then, there was a time where she said, okay, I'm ready for my next step in life. I'm leaving. And it came as a shock because I've only known her in Driscoll.
Yeah.
And so, she told me this position's going to be open. I recommend you going for it. And I said,
in her position.
In her position. I was like, okay. But I kind of saw, since I had been there, I saw that she was helping me in a way that one day she can, peacefully take a step away from this. And she knew that she had me there, if my leadership did end up deciding on me, that she knew I would be able to help with the department. And so, I interviewed, and I was so blessed to have the people that were in that interview select me. I prepared a portfolio. Like, it was huge.
Oh, like a paper portfolio.
Oh, yeah. Oh. Yeah. It had everything I had ever done. All my proposals, all my pitches, even the red line stuff, my proposed org charts. I was like, here's my 5-year plan.
Oh,
it's really hard to develop a 5-year plan, by the way. Oh, yeah. I look at it like, I'm like, that was really cute,
I love that.
Now it would be all electronic. Yeah.
Can you put that in your office? I would love to see it.
I can.
Please.
Yes. I have come a long way, but I love, because that's where it started,
yeah,
right?
Of course.
And we had these visions, and I was like, oh my gosh, this is so cool.
Yeah.
And then now I'm like, so it's really, that's interesting. I don't know what I was thinking. I was going to go through 75 pages of stuff in an interview. But, just kind of going back to everything that I got here, and I was able to work with I hired, honestly, a lot of people that were in our department already. They were able to get promoted. I mean, they had been through it all.
Yeah.
They were subject matter experts. It made sense. They were ready for the next step. And that's one thing I love to do. If I have the opportunity to promote from within, I will promote from within. Or if there's not a position in our department available, I will make sure that person is going to find another position, because, if I see from our team that someone's willing, wants to learn, it wants to challenge themselves, is trying to do everything possible to grow, I'm going to see that, and we are going to foster that and make sure that that person is able to go to the next step. And that's one of my favorite things to do in my position.
That's amazing. First of all, that really transpires into like where we are now and where your department is now. And it's just, I'm in awe, like knowing that I'm under the leadership that has built so much, and I'm excited to see where these years go. And I've never been so sure about a job before, and now I don't care to look anywhere else. Or like when people get just a little slump of anything, I don't care to look anywhere else, because if I feel a slump about something, like, well, it's just a day, it's just because I have content freeze or something like that. But I really feel like this is where I'm meant to be.
Good, and we love having you. And it's honestly, keep asking to learn things that you're interested in, and I promise you, someone's going to be willing to teach you something or show you, how to apply things. In jobs, you really get what you ask for. Like in the sense that if you really want to work hard and you want to keep asking for more things, I guarantee they're going to say, sure, let's go ahead and do it.
Nice.
For those that are not feeling like they're fulfilled, are you asking to learn more? That's the question you need to ask yourself.
I'm going to set up a meeting with you after this.
Recurring one-on-one.
Now that you're bringing it up, I'm ready.
I'm ready for it.
So just wrapping this part up about DHP, I know DHP is so much, it's a nonprofit community-based health organization.
Yeah.
And, in the most layman's terms, health insurance, but so much more than that.
Yes.
South Texas, we serve South Texas, and now that I'm on the other side, there's so much care that is given to members and non-members as well.
Yes.
Anyone who's just out in the community, anyone who's in the communities of South Texas, you are cared for by Driscoll Health Plan. Yep. What is one or two projects that are be coming up for our members and community?
Yeah, so one, it's going to start around May, it is our back to school season. And so we are already in preparation stage. We have to make sure we're securing venues. We have to make sure we're securing, employees. Our community partners are aware. We have planned quantity of backpacks and school supplies that's already being ordered. We will begin scheduling out, what events need social media coverage, video coverage. That's coming soon. And so we're already starting to kick it off. We anticipate, over 50 back to school events. And every year they are just so well attended. Our kids are ready to go. They have their supplies. They come in super happy getting their backpack. Parents are relieved because they have that available for the kids. A lot of our back to school events also have opportunities for sports physicals, immunizations, health education, a lot of resources. We always connect with partners that it makes sense to, I guess they provide a certain type of resource or barrier to our families. So maybe it's questions about transportation, or maybe it's something for financial advice. We try to get the right people there for those events. And so start staying tuned to our social medias developed by you, because those announcements will start flowing. Another project that's coming up is, or actually we just completed it, but it's still in the post-live stages of it, but we launched our brand new website.
Yes.
So we were working on it for about 1.5 years. We fully built out the website from our old server to our new server. All of the landing pages, the homepage, everything you see is brand new.
My favorite part of the new website is the community event recaps.
Yes.
So those stories, you see photos and little recaps on social media, but the stories give more information about what happened at the event. What was the motive behind it, and what was given out, and who it really affected. And you see photos of families.
I love those photos.
I love that section because it's just a great reminder of for anyone who's visiting the website, what we do as Driscoll Health Plan for everyone.
Absolutely. So if you haven't followed, go ahead and log on to driscollhealthplan.com, visit, take a look around. We have education, we have video libraries, everything that you need to know about Driscoll or your coverage, it's there.
Yes, agreed.
All right. So I'm putting on my co-host hat now, and I get to ask you a few questions. I'm super excited about this. So
hot seat now.
Yes.
I'm ready.
It's a fun seat to be in, though. So, Angela, you have been with Driscoll Health Plan for how long?
About a year now, more over the year.
All right.
Yes.
And what hat do you wear here?
I am the health communication specialist, so I manage our social media accounts and video productions that go within the social media accounts, like the reels, any video you basically see on social media or online. That's what I produce or help produce with the lovely help of our production companies.
Oh, yes. I might be shooting this particular one. No, that's wonderful. And so when you start posting things on Facebook, social media, what goes into your thought process there?
Oh, my goodness.
Hot seat, right?
So it's so much, because I have so much. Well, we have, as an organization, we have so much information we want to relay. Yeah. And I have, these pillars, these content pillars. Yeah. And it goes from health education. So it could be, pediatric, maternal, dental health. Yeah. And then, more entertainment-wise, that's, our outreach events, promotion, and everything like that. And then now, our reels, or, now this podcast reels. So, it's just, breaking that down. Like I said, there's so much information out there, and as someone who is just on our social media daily, we're looking for something that's quality. Yeah. And I want to be educated. Yes. And something that I didn't know before. So that's what the messages I try to relay on social media. We're more than just a health plan, sign up for health coverage. Mm-hmm. It's more let me educate you on this, on your kids' dental health, your dental health. Yeah. Trying to give the overall experience on social media. And that could be overwhelming at times, because it's I want to do this and do that. Yeah. And social media is changing so
Yes.
much, and it's, it is tough to kind of like stay on top of that, because we want to be relevant. Like the algorithm, as everyone probably knows, is changing. Like on Instagram, you don't really see the people that you follow anymore. It's more like your interest.
Yeah.
So it's just also like figuring out ways how to maneuver through that.
You do such a good job balancing out that content.
Thank
When you
you.
log into Facebook or Instagram, you see a variety of different things. And I think that's what keeps the viewers engaged. And so I really love just how you've been able to schedule, health education, but then here's something important. Here's a fun video. Here's a fun reel.
Yeah.
So you do a good job.
Thank you. That really means a lot, especially coming from you. When I was being interviewed for this position, I looked at other health plans, like their social media accounts and everything like that. And I saw Unison, and I saw what everyone else was doing. And it was kind of like the same thing. I wanted Driscoll to be different. And I was like, well, how do I do that? How do I make this small niche of, well, like, why am I going to go follow a health insurance account? To kind of like bring it out of the stigma of what everyone thinks and where people want to follow. People want to see themselves on our accounts. People want to see fun videos.
Yep.
People want also, even though we might not like it, or we might not like share it, but people want to see education as well. So that was really my goal coming into, and then wanting to take our social media.
Awesome. Well, you've done a good job completely, giving us a new, fresh look on our socials. Now, how many different platforms are we on?
So we are on Facebook, Instagram, Twitter, and now TikTok.
Fun.
TikTok, yes, fun.
Which one would you say is your favorite?
So to look on, I would say TikTok, because it's easier to get the videos that you want to see. Like compared to Instagram, where like I want to see what my followers are doing, but I have to kind of like dig through. And my favorite platform to post on, I would say Facebook, just because that's where all of our viewers are, or that's where all of our members and like people who love Driscoll Health Plan, that's where they are. And so I love that, because now we're getting so many more comments of like, this was so much fun, please do it again. And just even like those negative comments like of, I don't believe in this or this. I'm like, tell me, just tell me, know. And it's
exactly.
I mean, everyone has an opinion. Everyone's gonna have their own belief, and that's fine. As long as there's no like offensiveness on there, then I'll hide that comment. But everyone's welcome to our platforms and want to say their opinion, but just move by grace.
Absolutely. And I do agree. Facebook is what our families are on. All sorts of age groups, they're on Facebook. That's probably their first social media platform.
Even though I feel like people like Gen Zers now, like, oh, I don't get on Facebook. I think you do. I think you do.
Even if it's for a minute, they're on it.
Like, you're on there. I know you are.
They have a profile, a photo's there.
Yes. I think you get on your mom's too. You get on your parents just to see.
I totally agree. And so overall, where do you foresee our social media platforms going?
Oh man, I want our platforms just to grow. I don't think I have a certain place or a certain stop of where I want to take them. I just want them to keep on growing. Like for instance, our TikTok now. We are moving towards our podcast, and now everyone's doing a podcast. So how to make us stand out different, our TikTok is going to be like your health friend, your health education friend, just like, come along and just see like little snippets of it. And then our full video will be on YouTube, of course. But yeah, just like kind of just like going with the algorithm and just keep flowing. I just want our channels to be filled with content that gives quality to life, like how, from programs that we have and everything like that. I want to do my part in giving the quality of life for education and resources and just knowing about events. every time I see, or every time I boost like a flyer that we have, like I know it's reaching that many more people who need those resources as well.
Yeah.
So that's what I want to see. I just want to see just more full of life, full of content that's quality given, and yeah.
I love that. And I like how you're saying quality and resources. And I know that's something that, you've been in the journey too. Mm-hmm. And you've kind of seen, what Medicaid has to offer, but from a different perspective, as mentioned earlier. So tell us a little bit about that.
Yeah. So whenever I had my daughter in 2020, and I went back to school during that time. So it was like part-time school. I had part-time work at the school, and then I had her. So, don't have a full-time job, don't have like the benefits of a full-time job.
Yeah.
So I signed up for Medicaid, and I didn't know anything of it. I just got on the website, filled out what I was supposed to fill out. Don't know if I filled it out correctly.
Yeah.
And I remember seeing somewhere saying, like, if you don't pick one, then we're going to pick one for you. Mm-hmm. And I'm like, okay. Here, like, barely with not even a 1-year-old yet. I'm like, okay, yeah, I'll pick one. Never picked one. And so I ended up getting assigned to one, and it wasn't Driscoll Health Plan. Mm-hmm. And I was like, okay, great. She has coverage. And just like from one standpoint, 'cause I'm going to give multiple here, it was such a relief, for things being at no cost for my daughter. Yeah. It was such a relief because, especially that first year of life, so many things can happen. And she gets sick constantly. I'm a first-time mom, so I'm like, I don't know what this is. I'm just taking it to the doctor, kind of freaking out like that. And just knowing that it's covered or everything's at a very low cost, that's where I show my appreciation to Medicaid and the state of Texas, because as growing up with my mom, I was on the CHIP program. Okay. And not knowing what that was, I thought everyone was on it. I heard it a lot. Mm-hmm. But then growing up and forming my own perspective, I was like, people think low of Medicaid. Mm-hmm. And I'm like, okay, well, I mean, I really don't know what it really means, but I know, Medicaid equals like a low status, if anything. Okay. And now, whenever I had my daughter, I was like, this is amazing. Yeah. Like not everybody can have a full-time job, especially during the pandemic.
Oh, yeah.
Not everyone can have a full-time job. Everyone, people want to go back to school. People can't have a full-time job. Yeah. People are providers, it's, or like caregivers at home. It's hard. Yes. So just knowing that you and your loved ones are taken care of and are given the resources, given the care that you need at an affordable price, that's what really means a lot. Yeah. And I feel like that's the message I wish I just say bluntly, that it's a resource. Yes. As much as how many community health fairs that we go to or that anyone goes to, you get, I'm going to get this, I'm going to get that. Like, it's a resource. Yes. So my goal, if anything in life, and especially right now being on this side, I want to tell everyone, I want to spread the message of like Medicaid is good. It's resourceful, it's life-saving, especially to some people who need it and to have a quality life, like with help from other providers, help with just life in general, with assistance. And so, yeah.
Good. Thank you so much for sharing that. And I completely agree. At times Medicaid gets the stigma and it really, it's, I guess, in the areas that you live in, but overall, it's important for them to know why is Medicaid there? What does it provide? Yeah. What can it do for your family? And that's the main focus. Honestly, if you're eligible for Medicaid, please sign up.
Yeah.
Yes, exactly. You will have that peace of mind that your children are covered, or if you're expecting and you're a mom, you are going to be covered as well.
Exactly.
And on top of that, there's so many value-added services that you can receive. You go to a doctor's visit, you get a gift card. You go to, if you want to be like in baseball or gymnastics for your kids, if you want to sign up for them, they can actually get incentivized for that. There are so many different benefits to make sure that overall your family has the proper care that they need.
Agreed.
And that they're gonna be successful with anything that comes their way.
Yeah. And I do because I hear a lot like, oh, I don't get the proper care because I have Medicaid. Or I can promise you, your doctors or even your nurses don't know you have Medicaid.
Yeah.
They don't have no idea what coverage you get
Correct.
because they don't see that side of information.
Yeah.
The only person who sees is the front desk. And if anything, they're just trying to make the claim for you.
Yeah.
So no one knows you have Medicaid. And if it's like, if you're talking about quality of care, like, okay, well, maybe we need to consider a different doctor's office. But I can promise you, like, doctors don't know.
No, they're there for you, the patient. They want to make sure you're
And they
taken
don't care.
care of. Exactly.
Yeah.
They're there to provide the best quality. Well, thank you so much, Angela, for sharing all of that. And I definitely encourage, if there's any opportunity, seek out Medicaid, seek out CHIP. It's definitely worth it. It will be a life-saving opportunity for your family and even for yourself.
Agreed.
All right. So this has been so fun. And I
really
know
has.
there's a lot of inspiration behind why we are here right now, sitting with this amazing equipment and our watered down coffee.
Yes.
But I want to ask, why the podcast? Like, what inspired you to be here today for this?
So like I mentioned earlier, there's so much information out there. And it's like, how else can I relay these messages? And I see podcasts are becoming more popular. I'm like, okay, do I want us to be another fish in the big pond of podcast? I'm like, yeah, first of all, why not?
Yeah.
Second of all, we have so much information that we can decode, hence Driscoll Decoded.
Yeah.
Because we can put up messages out there like, the flu is this, symptoms are this, but people want to hear, what does that really mean? Tell me in my own language. And so that's what I want to do, like with this podcast. I want to bring in all these experts, medical, dental, maternal health, and kind of just have like real conversations with them and say like, okay, this happened to me, as I'm sure probably someone else. Like, what does this mean? What can we do better about this? And, about flu or like immunizations or anything, like what does that really mean? What goes into that? So we can have deeper conversations and more than just a post. It's always going to live. You're going to hear someone talking about it and like from an expert themselves. So just kind of having that conversation with a friend. And I'm really excited for this podcast because there's so much lined up already.
That's so exciting.
And if our viewers, if they have any topics they have in mind or like any questions, I would love to hear all that. And, you could either send us a message, send us a DM, comment on this episode, comment below, to see what ideas you'll want to hear. And, the point of like this podcast is like to talk about, explain the misunderstood.
Ooh, I like that.
Explain the misunderstood, because healthcare, medical it can be so dense. And, we could put a blur over our eyes and just hear it. And that's what I want to do. I want to break it down. And I want it to be so understandable where it's kind of like bringing in health literacy and just making it so understandable for everybody, parents, kids. And I just want this to be like the hub where it's your health information friend, that if you go to Driscoll website, you go to Driscoll social medias, or you call Driscoll, like you're going to get educated in every type of way that you don't want to lose us as a friend.
I completely agree. We are definitely that friend of the family tagline that we carry on. And that's so exciting. So who do you have planned next?
Yes, so I have Dr. Sorrell coming up. Oh my gosh, he is amazing.
That's going to be fun.
Yes, he is the doctor you see on all our social medias. He is a joy on camera, and I'm just so excited because he's going to break down a couple of health topics for us. And we're going to get to know him even more. And so people, when people see someone on social media, like when I put our CEO on there and or any doctor, like they're not just a doctor. They're not just a CEO. Like these are your friends, these are the people who come up with who lead these initiatives and for the better of you.
Absolutely.
And so I'm real excited to talk to him and for our viewers to know him more. And then I have Dr. Doucet. She
good.
is, our OBGYN associate director. Long titles here.
Yeah, we love them.
And we'll be talking about maternal health. I'm just so excited because we're breaking down everything, everything that people want to hear, those topics that are not talked about a lot. Yeah. We're going to bring them here. We're going to bring them to light.
Good. It's like ask the medical expert. Mm-hmm. I love that. But here in TikTok.
Exactly.
And YouTube.
Exactly. And so I'm ready to bring everything to light. I'm ready to make everything understandable for everyone. And it's going to be a journey. So I'm really excited for the future of this podcast. So make sure everyone subscribe to our YouTube channel. So many videos will be coming. There'll be full-length videos, and then you can find snippets on it of reels on our social medias and our TikTok. So just make sure you're following, subscribe, and I just want to thank you so much. This has been fun.
It has been so fun.
This has been great.
I'm happy to be here, and thank you so much for inviting me. Our coffee got somewhat drank today, but
we need coasters. It's a little wet right here.
We're gonna get one.
Cheers, and see y'all on the next one.